Hi, I'm Brittany Rader. This is my capstone presentation. I chose the floor that I was supposed to do precepting on. It's the AMC General South, 7 South. It's a med-surg floor. It's a 30-bed unit. They take care of patients that require cardiac monitoring, general medical patients, patients who have had kidney transplants, patients needing critical IV medication, and pulmonary patients. On this floor, an RN or an LPN is assigned a few patients, usually about 3, unless it's a critical patient. An example of this is a patient who just had a kidney transplant who will be the nurse's only patient assignment because they require more attention and they're a higher acuity of care. The nursing assistants usually divide the floor into 2 or 3 sections and care for many patients at a shift. The charge nurse gets a report on every patient at the beginning of the shift so they know what's going on with the whole floor. They assist the other nurses either by delegating help or even going themselves and providing care. Sometimes they even have their own patient assignment as well. The discharge nurse manages all of the discharges happening that shift. They coordinate with PT, the social worker, and the charge nurse to meet the patient's needs for discharge. There is a discharge meeting every day. The nurse manager attends bed meetings, manages the schedule, and is responsible if there is a call-off. They are someone that encourages the staff to come to them for problems. They represent the staff and reinforce good patient care standards. Nursing school has taught me the importance of advocating for our patients. During clinicals, I found that the best way to assess patient needs is to spend time with them and to talk to them. Just by having a conversation with your patient, you can find out their goals, their values, and what they need. In class, we learn that actively listening and asking open-ended questions establishes trust and encourages the patient to share their feelings. In clinicals, this proved to be true because when you take the time to listen to the patient's stories about their kids or their pets or their childhood, you find out what is important to them. They find out that they can talk to you about their other things, such as worrying about how they will find transportation to their next doctor's appointment, or if they aren't sure that their insurance will cover their medications. During one of my clinicals, a patient was telling me about her family, and I learned that her daughter drove her to her appointments because she didn't drive. She then told me that her daughter was moving and she was worried because she didn't know what she would do for her next doctor's appointment. I told the nurse, and she made a referral to the social worker to try and help this patient. A lot of the time, families have a big influence on patients, especially here in West Virginia. So it's really important to make time available to talk to them and to make sure they are informed on what's going on, as long as the patient is okay with that. They may have questions about care, and if the family is going to be helping with the patient at home, they need to know what they need to do. One of the ways that I was able to collaborate with the patient and his family was through his diet. He needed a cardiac diet, and his wife made most of his meals. So I talked to them about what types of foods are low in sodium and what types of foods had healthy fats versus foods with unhealthy fats. There are some things that nurses can do to improve a patient's quality of life. Educating the patient and their family will allow them to make informed decisions about their care. Performing good assessments to find out if there is anything that needs addressed is also important. During clinicals, another student and I were giving a patient who was confused a bath, and we found a stage 2 pressure ulcer. We notified the nurse, and she put a dressing on the ulcer, and then we made sure that the patient was turned to relieve the pressure. My nursing judgment has improved throughout nursing school. I am able to do thorough assessments and make plans and interventions. During a sim lab one time, I tried to call a MET team because a patient's blood pressure dropped after giving nitroglycerin. I learned that the correct intervention was to hold the next dose, not to panic. I've learned a lot about when to delegate a task and who I can delegate to, especially during these last 2 semesters. This semester, I've learned about prioritization of care. This is important in any field that any nurse goes into. I was able to observe in the ER, and the nurse I was following had so many things that she needed to do, so it helped me to see how she prioritized what she needed to do first and what could wait. One of my favorite classes in all of nursing school was when our instructor brought a mannequin in and had students do their ABCs. That will probably stick with me forever. A few more examples of how my judgment has improved. During clinicals, I was assessing a patient who told me that she was dizzy when she stood up. In report, we had heard that this patient was independent and walked to the bathroom herself. So I notified the nurse and we took her blood pressure laying down, sitting, and standing. She had a big drop in her pressure, and so she had orthostatic hypotension. In previous semesters, I might not have thought to ask about the dizziness, and I'm not sure if I would have known to notify the nurse. Another way that my judgment has improved is that now I know what to assess for when I'm giving medications. I know to check vitals and labs first, and I know what side effects to watch for. Best practices are the best way to provide safe and effective patient care with proven results. One of the best evidence-based practices to prevent infection, which every nursing student knows, is hand washing. I did this often during clinicals. Another thing I did to prevent infection was Foley care. I maintained aseptic technique during Foley insertion, and with the patients who already had Foleys, I performed hygiene and Foley care. Another thing that I did was to wipe the opening of the Foley bag with an alcohol prep wipe after emptying the Foley. Something that I also made sure to do was to wipe down the vitals machine after using it, especially if it was in a contact room. I was also able to assist a patient with early ambulation after surgery, which is proven to result in better outcomes. These are all easy ways to prevent infection and implement best practices in my nursing care to keep patients safe. As nurses, we are supposed to provide care, answer questions, comfort our patients and their families, listen to their stories, and calm their fears. Patients rely on nurses to take care of them. In order to do this, we need to know our own professional identity. We need to have integrity. This is the inner character that helps to deal with obstacles. To me, being honest and fair and trustworthy is how I know that I did the best I could and that I did what I thought was right. As a new graduate and as a nursing student, part of having integrity is admitting when I don't know the answer and letting someone know if I made a mistake. Nurses have a lot of responsibilities. We must advocate for our patients, protect their confidentiality, and provide the best care possible. In clinicals, I have made sure to learn as much as I can to be able to take care of my responsibilities as a new grad. Another part of my responsibility is being accountable for my actions. I make sure to own up to my mistakes so that next time I will do the right thing and not make the same mistake twice. Ethical practice in nursing is doing the right thing for your patient to keep them safe, to provide competent care, and to promote health and healing. I need to know my own morals and ethics to know what to do when complications happen. Respect and a strong work ethic are a part of my identity. Nursing school has prepared me for the future by giving me critical thinking skills. All of the sim labs, the practice quizzes, and the case studies that I've done have allowed me to think outside the box and have given me much better problem-solving skills than I have ever had before. During clinicals, simulation days, and externing, I have had lots of hands-on learning. I feel confident that I'm ready and able to do the hands-on skills that nurses need to know. My communication is so much better than it was when I started nursing school. I am ready to communicate with patients, families, and the healthcare team as a new grad. I feel like I'm ready for the NCLEX from all of the practice quizzes and exams I've taken. They have brought my confidence in test taking up and will definitely help me to pass the NCLEX. Nursing school has changed me as a person. I chose nursing because I wanted a career that would allow me to take care of my family. It turned out to be so much more than that. I have become more confident, more empathetic, more humble. I can think quickly. I can be assertive, but I'm also more caring and have learned to connect with others. I feel honored that I soon will be able to call myself a nurse, and I'm so thankful for all that I've learned in nursing school.